This lecture is going to go over migraine headaches and the medications used to treat them, and then in the end of the chapter, questions we might have. So, migraine headaches are characterized by unilateral throbbing head pain accompanied by nausea, vomiting, and photophobia. These symptoms usually persist for around 4 to 24 hours and for several days in some cases. The exact etiology of migraine headaches is unknown, although many theories exist. A common theory suggests a series of neurovascular events initiates the migraine headache. There are two types of migraines: migraines associated with an aura, which occurs minutes to an hour before onset, and then migraines without an aura. Triggers of migraines: there's a lot of things that are associated with triggering migraines. They include cheese, chocolate, red wine, sugar substitutes, stress, missed meals, odors, hormonal changes, weather, too much or too little sleep. Cluster headaches, on the other hand, would be severe unilateral non-throbbing pain, usually located around the eye. Occurs in a series of cluster attacks, one or more attacks every day for several weeks. They are not associated with aura, do not cause nausea or vomiting, and are more common in males. So we're going to talk about medications used to treat migraines. And the first thing to think about is the medication being used, is it a preventative medication, preventing the migraine from occurring? Or is it management? So once it occurs, I'm going to take the medication and manage the pain that I'm experiencing. So preventative treatment include beta blockers such as propranolol and atenolol, anticonvulsants, and tricyclic antidepressants. So again, these preventative medications would be medications that the patient would take daily to prevent the migraine. These lists of medications that are used for management would be medications that would be taken once the patient suspects they're beginning to have a migraine. They can include analgesics such as aspirin with caffeine, acetaminophen, or NSAIDs. Opioid analgesics such as meperidine may be used. Ergot alkaloids are also used to treat migraines. Dihydroergotamine, you may also hear referred to as DHE, can be administered many different ways: sub-Q, IM, IV, or by nasal spray. And then finally, the selective serotonin receptor agonist. If you look at the ending of those, also ergot alkaloids such as dihydroergotamine, you might hear it referred to as DHE, can be used for management of migraines. DHE can be administered many different ways: sub-Q, IM, IV, and by nasal spray. And then finally, a popular classification of medication for migraines that you need to know is the selective serotonin receptor agonist. And these medications are frequently just called triptans. And if you look at the medications listed here, sumatriptan, zolmitriptan, they end in triptan, which is your clue that you're dealing with a triptan. And sumatriptan is actually your prototype medication for this classification. So how does sumatriptan work? It works by causing vasoconstriction of cranial arteries. It's used to treat migraine and cluster headaches. There's some of the side effects listed for you: drowsiness, dizziness, flushing, fatigue. Some of the more severe ones include seizures, dysrhythmias, heart attack, stroke, and suicidal ideation. Again, with triptans, these are for management of migraines, so it's important that the patient is taking the medication when they first suspect that they're having a migraine. So these medications need to be taken early during a migraine attack. All right, so let's look at some of our practice questions. Question 1, the next day the patient's pain medicine is changed from morphine. So it looks like I'm missing a part 1 here, but a patient's pain medication is changed from morphine to hydromorphone. Which statement regarding hydromorphone does the nurse identify as being true? Pause the video and go ahead and look and see if you can figure out the correct answer. The correct answer is D. Hydromorphone is more potent than morphine. The analgesic effect of hydromorphone is approximately 6 times more potent than morphine. Question 2, the nurse assesses a patient receiving morphine via a PCA pump. The patient has a respiratory rate of 6 breaths per minute. The nurse anticipates administration of which of the following drugs? If you chose the option A, naloxone, that is the correct answer. That is an opioid antagonist or blocker. It is an antidote for opioid analgesic overdoses. Question 3. The nurse identifies which of the following is a common side effect, adverse effect of morphine therapy. If you answered C, that's correct. Urinary retention, constipation, hypotension, and decreased respiratory rate are common side effects of morphine. If you remember that opioid is turning down the body's systems. So correct answer again, C, urinary retention. And the final question, a patient received morphine sulfate for severe pain. The nurse assesses the patient 20 minutes later. What is the best indication that the medication has been effective? If you chose A, patient verbalizes pain relief, that is the correct answer. Again, pain is subjective, and the best source of information about pain is from the patient.